Hey friends, welcome back. It's Sarge, your favorite YouTube therapist. So today I want to talk a little bit about to medicate or not to medicate ADHD. Now, as somebody who's been in the field of psychotherapy for over 25 years and somebody who grew up with undiagnosed ADHD, I did not take medication, and I've thought a lot about this. There's pros and cons that I think are worth discussing. I hope this video helps some parents out there. Obviously, with all medications, there's some risk of side effects, and having talked to adults who are taking some of these ADHD medications, having talked to some of the adults who take these ADHD medications, one of the things that I hear frequently is that they feel like they need more and more of them to keep up that level of focus and and attention. Speaking of which, anyways, we'll go ahead and leave that in the video. But so obviously, if you're having concerns about this and you're thinking about this, those are questions you're going to want to speak to your doctor or your nurse practitioner about. Ask those questions about, like, what are the possible side effects of this, and you have to weigh the pros and cons. Now, if you decide to not go medications, there's also some things that you need to be aware of. It is definitely a harder route for kids with ADHD and adults with ADHD. Not impossible, but it's harder to do what they want to do without medications, right? So there's some techniques that you can learn, such as the Pomodoro method, which I'll talk about in just a second. And also, if your kids are struggling with these issues, it may be worthwhile talking to them about, are they interested in trying some new activities? Two things that come to mind for me are martial arts and equine activities. Now, both are unfortunately very expensive, but maybe you're in a position where those are activities that you can afford. Both of those do require you to train your brain to learn to focus, to get tasks done. Both of those are actually great outlets for the mood component of ADHD, and there is a mood component of, which I will also talk about in just a second. And both of them can also improve your self-esteem quite a bit, which is also a component of ADHD, is that struggle, not just academically, but socially, right? Because having ADHD can cause some problems in your relationships due to the impulsivity, due to the frequent interrupting, due to the dropping out of conversations early, things like that can be really hard on relationships. So this will, and that has a significant impact on kids' self-esteem. We've seen this not only in practice, but there's a lot of evidence-based research about this as well. So equine activities, martial arts activities, and maybe you can come up with some other ones to put down in the description down below as a comment. Those are fantastic activities for you to think about for yourself if you're an adult with ADHD, or your child if your child has ADHD. The mood component is really complicated, and I think it gets missed by a lot of primary care physicians, a lot of doctors, but because of the mental tiring effect of dealing with ADHD without medications, right? It's like mentally and physically exhausting to try to maintain your focus all day long if you struggle with this. And it affects the neurochemistry of the brain. It affects the norepinephrine particularly. And there's a mood component to that, which can cause depression and agitation as well, right? So those are other components. And a lot of times I have had people who come into me who've been diagnosed with depression, and it turns out that it actually was more of an ADHD-induced depression. So just be aware of that. And if you're going to try to manage this without medications, you're probably going to need to have some cognitive and behavioral techniques as well for the mood management, in addition to the attention and focus, right? And again, that piece of ADHD unfortunately gets left out of the equation for a lot of people. All right, so then if you decide not to go the route of medication, one other concern that you should think about is that as an adult, if your child as an adult decides, like, hey, I really do think I do need medication, that it would probably help me, I'd be more efficient in my work, it would probably help my relationships, it would probably help me to get tasks done more, they're going to have a harder time as an adult because they didn't have the childhood testing to support the ADHD diagnosis. And because, unfortunately, And because unfortunately there's some people out there who abuse ADHD medications, especially the stimulants, many practitioners do not want to prescribe ADHD medications for adults. So they're going to have a hard time finding somebody that's willing to do that. And that's a factor that you should consider as well. And maybe if your child's a teenager, you need to involve them in that decision making a little bit. That's a parenting decision. I'm not going to tell you what to do. So the last thing I want to talk about here is the Pomodoro method, which can be used with or without medication. The Pomodoro method basically involves learning to train your brain to stay on task, to train your brain to stay focused for periods of time, right? So there's a dopamine deficiency, a dopamine depletion chemistry piece of this for the ADHD brain. So for somebody like myself that has ADHD and doesn't like to use medications, we have to really develop the brain more so than would be, common for a neurotypical person, right? The Pomodoro method is one of the ways that you can do this. And basically what it involves is you set a timer, right? And start in small increments, like 15 minutes. And you're training the brain to stay on task, whether it be completing a household chore or your homework or a work task. Stay on task for 15 minutes, and then when the timer goes off, you give yourself a small reward. By small, I mean getting up, moving around, maybe talking to a friend. Be careful to engage in activities that can pull you way off your trail, such as social media and things like that. So when I say small, I mean small, temporary, quick dopamine-induced reward, right? It can be a small piece of chocolate, but you don't always want to, or peppermint or something. You don't always want to use food because then, if that's constantly your reinforcer, that can become another problem, right? And then after 4 consecutive successful times of staying on task for those 15 minutes, you get a larger reward, maybe a 15-minute break from your work or something like that. So that's called the Pomodoro method. It was developed by a college student who was having trouble staying on task himself. So I hope this video was helpful. Again, we're just touching on some real big basics here, but let me know in the comments down below. Maybe there's some other components of this discussion that I left out that you think are very important. And the question you'll need to ask yourself if you're an adult with ADHD or if you have a child with ADHD is, do I want to go the medication route or not? Make sure you take care of your mental health, folks, because your mental health matters.